At Carepatron, we are constantly looking at ways to improve. If you have any feedback on how we can improve our platform or videos, please leave us a comment in the comment section below. Sliding scale therapy, a vital aspect of mental health services, offer a flexible fee structure to accommodate clients' financial needs while ensuring access to mental health professionals. However, the dynamics of sliding scale therapy warrant a closer examination due to its potential impact on therapists and clients. Addressing mental health challenges such as depression, anxiety, and PTSD, which are more prevalent among those in financial hardship, sliding scale therapy provides critical access to necessary mental health services. When discussing sliding scale therapy, it's crucial to acknowledge its positive impact when appropriately implemented. Many therapists diligently utilize sliding scale fees to make therapy more affordable for individuals facing financial constraints. However, challenges arise when the system deviates from its intended purposes, affecting the quality of treatment and potentially harming both therapists and clients. While sliding scale therapy aims to address financial barriers to mental health care, it also presents unique challenges. Clients may seek therapists offering sliding scale fees, sometimes driven by genuine financial need. The process of sliding scale therapy involves several steps. Firstly, assessment and evaluation. The therapy journey typically begins with an initial assessment and evaluation session, during which the therapist and client establish rapport and discuss the client's presenting concerns, treatment goals, and financial situation. Fee negotiation. Once the assessment is complete, the therapist and client engage in a discussion about fees. Clients who require financial assistance may express their need for a reduced rate, while the therapist evaluates their ability to accommodate such a request. Agreement and documentation. Upon reaching a mutually acceptable fee arrangement, the therapist and client formalize their agreements through documentation, which may include a sliding scale fee contract outlining the terms and conditions of the arrangement. Ongoing monitoring and adjustment. The therapist monitors the client's financial situation throughout therapy and reassesses the fee arrangements as needed. Termination and transition. As therapy progresses, the therapist and client work collaboratively towards achieving treatment goals. When the client is ready to terminate therapy, the therapist facilitates a smooth transition, which may include discussing post-therapy resources and providing referrals for ongoing support if necessary. To learn more about sliding scale therapy, go to our Carepatron website or click on the link in the description. We have a range of guides and articles to help you learn more about different therapy techniques to incorporate into your practice. Carepatron is a top choice for therapy practice management software due to its comprehensive features, user-friendly interface, and commitment to client-centric care. Signing up is free. Just click on the link in the description. Thank you for watching our video. If you enjoyed this video, don't forget to hit the like and subscribe button for more content like this.